Okay, so we're doing sub-Q injection with heparin. So I'm going to grab my MAR. See that it's for Chad Tucker, date of birth 6/24/55, allergies to penicillin. He has a diagnosis of hip fracture, ear infection, COPD, CHF, atrial fibrillation, seasonal allergies, diabetes. It looks like Dr. Jekyll has ordered heparin at 5,000 units, subcutaneous, BID, so twice a day at 9 and 1700. So it's 10 minutes before 9, so we're gonna get that started. So I'm gonna go into my my med room, and I'm gonna grab my drug guide book, open it up to my heparin page. I'm gonna read it over, write down stuff I need to remember on my little sticky note. And what I have written down is that it is a prophylactic treatment for venous thromboembolism so that we're not getting blood clots in the hip, or anywhere for that matter, from the hip fracture. I want to make sure that he doesn't have any bleeding disorders, hypersensitivity, open wounds, thrombocytopenia, and I would be cautious with liver, kidney disease, hypertension, and ophthalmic surgeries. And I'm going to make sure my safe dose, we're in the safe dose range. He's ordered heparin, 5,000 units. And it says in here you can get 5,000 units every 8 to 12 hours. All right, so we're good there. And I'm just gonna make sure that for my education, for my patient, I'm gonna make sure that he understands that he should report any bruising or any bleeding if his blood pressure is lowered, or if his hematocrit is lowered, any blood in his stool or urine. And so we'll get started. I don't see any contraindications that I would be worried about. So we're gonna get started on preparing the medications, and I'm gonna keep this for my stuff. So I'm working on a clean area. So I'm going to wash my hands. I'm gonna gather my supplies. I'm gonna get my gloves on. While I'm getting my gloves on, I'm thinking about what I need. So I need a 25 to 27 gauge needle, 3/8 or 5/8 inches in length. And I'm going to use a 3 milliliter syringe since we'll be giving 1 milliliter because it's packaged 5,000 units in 1 milliliter. So we'll use a 3 milliliter syringe. Okay. So I've got my stuff here. I've got an intact vial of heparin, 5,000 units per milliliter. I'll show you that. Okay, the lot is 1, 2, 3, 4, 5 with an expiration of 10/30/21. And it says it's for IV or SubQ, but we're going to do SubQ today. It's a multi-dose vial, so we are going to draw up our meds in the medication room, label it. Let's see, it's intact, no particles, clear solution. Okay, so I'm going to give it a little shake by rolling it in between my hands. Okay, so we'll do that here. I've got my 25 gauge needle with a 5/8 inch. It is intact. Expiration date is not expired. We've got an intact needle for drawing up the meds. We don't want that shearing effect. It's intact within the expiration date in an intact 3 milliliter syringe. Within the expiration date, 2 alcohol swipes, 1 for the vial, 1 for the patient. They're both within the expiration dates. Okay. And I'm going to make sure that I draw up 1 milliliter. So I'm going to take that buff cap off. Okay, and I'm going to scrub for 30 seconds. Let that alcohol dry. And I'm going to save that for a second. So I've got my 3 milliliter syringe. I'm going to banana peel that, not touching anything. Okay, I've got my drawing up needle, banana peel that, not touching anything. Okay, so I'm going to take my 3 milliliter syringe, snap, trash. Okay, so my syringe is here, and I've got, I'm going to drop one milliliter of air so we can put that into the vial. Okay, save that here. And we're going to make contact with the vial first, stabilize it, inject our air, turn it over. And we've got 1 milliliter. Okay, it's stabilized, pulling out. I'm putting my vial away. I'm going to use the scoop method. Okay, make sure it's capped. Okay, so I'm going to hold this here. I'm going to use my 25 gauge needle with the 5/8 inches. Okay, and it looks like it was put in there wrong, so hang on a second. I'm gonna banana peel it. I'm gonna get rid of this syringe because we don't need it. Trash. Okay, and I'm going to switch my needles so we don't have that shearing effect. So this goes in the trash, and my needle goes in the sharps. Okay. All right, so I'm going to do my first check real quickly. I've got heparin, 5,000 units, and I've got 5,000 units in 1 milliliter, so we've got that 1 milliliter in there. It's going to be for Chad Tucker, prophylactic thromboembolisms. The expiration date is 10/30/21. This is 1 milliliter, 5,000 units. And I'm going to make my label real quick with my snack and my initials. Okay, Got my label. I'm going to take off my gloves, wash my hands. Okay, we've got no air bubbles. Wanted to mention that. Okay, so I've got my alcohol prep for my patient, my drug, and I'm going to go get my second check off with my nurse at the nurse's station. Okay, so I'm going to go over my MAR with her and say, Nurse Carrie, can you just check my second check with me? So I've got Chad Tucker. He needs 5,000 units of heparin for prophylactic treatment of hip fracture, and he's allergic to penicillin, so that's not what we have to worry about. And the time is at 9. It's 5 minutes till 9, and I've got my label here. This is 1 milliliter, 5,000 units in 1 milliliter. There's my 25 gauge needle, 5/8 inches in length. I'm going to assess my patient for any bruising or bleeding, and any hypersensitivities. I've already checked out my patient. He's average size, so I'm going to use the 90-degree angle into the fatty tissue of the abdominal area, but I want to make sure that I am making sure that an inch away from the belly button so that we're not too close, and I would alternate sites to make sure that I'm not injecting into the previous spot that was injected into yesterday. And my expiration on everything is 10/30/21, and that's my second check. Is there anything else you need from me? No. Okay, you've checked it. So I'm going to go to my patient, and I'm going to say, knock, knock. Oh, Chad Tucker. Hi, my name is Morgan. I'm a student nurse. I'm here to give you your heparin, which is a blood thinner. So I'm going to wash my hands, and I'm going to provide privacy while I let you know what's going on with this. Give you a little bit more information. Can you just tell me your name and date of birth really quickly? Chad Tucker, 6/24/55. Great. Do you have any allergies? Just to penicillin. Good. We're not using penicillin today. I'm going to just check to make sure there's no obvious bruises or bleeding on the outside of Mr. Chad Tucker, and he looks pretty good to go. So I'm going to educate my patient real quickly after I do my third check. So I've got Chad Tucker, heparin, 5,000 units in 1 milliliter. This is 1 milliliter, okay? And expiration date is 10/30/21. And it's ordered for 9. It is 1 minute until 9. So we're going to do some patient education really quickly. So I want to make sure, Chad, that you know that this is to make sure that we're preventing any blood clots from happening with that hip surgery going on. We want to make sure that you don't have any bleeding or bruising disorders. You don't have any liver or kidney issues, and I want to make sure that you know that you're not supposed to have any aspirin or any NSAIDs like ibuprofen while you're using this, and make sure you use a soft toothbrush so that your gums don't bleed really badly, and an electric razor so that you don't cut yourself, because those are harder to cut yourself with. We'll make sure that you have an ID card, and I want to make sure that you know that if you have any bleeding in your gums or your nose, or you notice any bruises or blood in your stool or urine, any lowered blood pressure or hematocrit, that we report it right away. I'm going to come back and check on you in about 30 minutes. So here we go. I'm going to have you lay down. I'm going to have you lift up your shirt so I can assess your abdominal area, so I can find where to go. Gotta get my gloves on. You know what? Before all of this, I would have done a 60-second patient check. I want to make sure there's beds locked and lowered. I did his allergies when I came in, and I did provide privacy, but I would make sure that his IV is intact and there's nothing on the floor, no trays, bed is locked and lowered, he's got his call light, and now we're ready to go. So I'm having him lay down. I've checked his abdominal area. I'm going to use my alcohol prep to clean it. So I'm gonna put this forward. Okay, Chad Tucker, you're laying down. Good. Okay, so we've got his abdomen right here. You can clean this for 30 seconds. Good. I did my third check. Sorry, I'm going to do my third check while that dries really quickly. So I've got Chad Tucker, 5,000 units. I did my third check. But anyways. Okay, so it's dry. We're making sure we're going 1 inch away from his belly button. Okay, so we're going to do the Z-track method. So I'm pulling the skin slightly up and over, and I'm going to do a 90-degree angle. Okay, so like a dart. Okay, so I've got this up 90 degrees, stabilize it, slow inject, let go of the skin, come out at a 90-degree angle. I would push this up for my sharp stick container, but I'm going to use my sharp stick container, drop it in. Okay, so I'm going to clean up anything else, put a Band-Aid over him. Okay, assess the site. I'll come back in 30 minutes. So I'm going to take off my gloves. Okay, clean my hands. Hey Chad, also I want to make sure that you have your call light with you. I want to make sure that you don't try to go to the bathroom by yourself. We really want to make sure that you don't fall and get any extra bruises on this medication. So use your call light, please. And I'm going to make sure there's no cords or anything in his way. Bed is locked and lowered. IV is still patent. Can I get you anything else, Chad Tucker? No? Okay. I'm going to document then really quickly. So I've got, I'm gonna look for 9 o'clock and the date is 10:30, 20. I'm gonna do my initials, snack, over 10:30, 20. Okay, and my initials down here. Or my signature. My initials, snack. Okay, and I'm going to write down the location. So I did the right lower quadrant, right abdominal. Okay, and 9 o'clock. I went under the 9 o'clock. Okay, so I documented. All right, and that's it.